Let's learn about high blood pressure and how it affects your body. High blood pressure, also known as hypertension, is a condition where the force of blood against the artery walls is too high. It's like having too much air in your tires. This force is created by your heart as it pumps blood throughout your body and is measured in millimeters of mercury. There are two key measurements to understand. The first is systolic pressure, the higher number, which represents the pressure when your heart beats. The second is diastolic pressure, the lower number, representing the pressure when your heart rests between beats. Normal blood pressure is generally around 120 over 80 millimeters of mercury. But when the pressure consistently exceeds these normal levels, well, that's when we start talking about hypertension. So when blood pressure consistently exceeds normal levels, that's when we call it hypertension. Now, you might wonder, how is blood pressure classified? Well, the American College of Cardiology and American Heart Association have a clear way of doing this. Normal blood pressure means your systolic pressure is less than 120 mmHg and diastolic is less than 80 mmHg. Elevated blood pressure is when systolic is between 120 to 129 mmHg and diastolic is less than 80 mmHg. Hypertension stages 1 and 2 are classified by higher measurements. So that's how healthcare professionals classify your blood pressure. If you or someone you know is dealing with high blood pressure, there are ways to manage it. Let's dive into some of the ways you can manage and reduce high blood pressure. Starting with a healthy diet, consider following the dietary approaches to stop hypertension or DASH diet. This diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Equally important is reducing your sodium intake. Limiting your salt intake can help control high blood pressure. Aim for a sodium intake of no more than 2,000 milligrams per day, or even better, 1,500 milligrams per day. Regular exercise is another crucial component of managing high blood pressure. Activities such as brisk walking, jogging, swimming, or cycling can be beneficial. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Maintaining a healthy weight, limiting alcohol intake, and quitting smoking can also significantly impact your blood pressure levels. Managing stress through techniques such as deep breathing, meditation, yoga, or progressive muscle relaxation can also be very helpful. While the relationship between caffeine and blood pressure isn't fully understood, it may be beneficial to limit caffeine intake, especially if you're sensitive to its effects. Lastly, regularly check your blood pressure at home if recommended by your healthcare provider. This can help you track your progress and identify any changes. Remember, each step towards a healthier lifestyle is a step towards managing high blood pressure. Consult with your healthcare provider for a plan tailored to you. And if you found this video helpful, please give it a thumbs up, subscribe, and share it with anyone who might benefit.